Good evening, everyone. Good evening, sir. You are on mute, actually. So this is an important occasion for every one of us. Today is the World Day on Safety and Health at Work 2022. And from Indian Association of Occupational Health, we have organized this program, this webinar on enhancing a social dialogue towards a culture of safety and health. Before I start, may I request our President, sir, to give a broad perspective of this particular day and give us remarks towards the day and about something about how our efforts they are towards the achieving these goals from Indian Association of Occupational Health. Dr. Vijay Rao, sir, President IU.
Thank you, Dr. Sandeep. Am I audible?
Yes, sir.
Yeah, thank you very much. Good evening. A very good evening to all my IOH members. As you all know, IOH in collaboration with ENOCH DigiConnect, we are organizing this World Day for Safety and Health at Work 2022. In fact, the ILO is celebrating all over the globe with a aim of act together to build a positive safety and health culture. And in fact, in recent new report of ILO, it says response to the COVID-19 pandemic have shown the partners in preventing occupational accidents and diseases. So the annual World Day for Safety and Health at Work on 28th April, that is today, it promotes the prevention of occupational accidents and diseases globally. The World Day for Safety and Health at Work 2022 focuses on enhancing social dialogue towards a culture of safety and health. Participation and social dialogue in creating a positive safety and health culture is the need of the hour. Throughout the COVID-19 pandemic, we have seen that having a strong OSH system, which includes meaningful participation of governments, employers, workers, public health professionals, and all relevant parties at the national and enterprise level, has been crucial in protecting working environments and safeguarding the safety and health of the workers. The COVID-19 pandemic has shown that the effective collaboration between employers, workers, and governments is the best way to implement occupational safety health measures that can save lives. Through effective social dialogue, governments and social partners actively participate in all phases of OSH decision-making processes. This is important from the development and revision of OSH policy and regulatory frameworks to address persistent and new OSH challenges to actual application at the workplace level. Social dialogue not only contributes to improving OSH policies and strategies, but it is also essential to build ownership and commitment, easing the way for their rapid and more effective implementation. During the pandemic, governments who prioritize the active participation of employers and workers' organizations in OSH governance were able to develop and implement emergency laws, policies, and interpretations such as lockdowns, travel restrictions, work from home, so many measures to prevent and deal with cases of COVID-19 in the workplace to telework arrangements. And the same were essential and ensuring that the measures put in place were acceptable to and supported by employees and workers, and were therefore more likely to be effectively implemented in practice. It was possible through a social dialogue, and which is also key to strengthening safety and health at work. Today, IOH is organizing, celebrating, in fact, this World Day for Safety and Health at Work 2022 to this program is to bring together and expertise, discuss the theme and share their experiences and practices from around the world. And today's speaker is Dr. R.K. Jain sir, who is a very well-known figure, and he doesn't require any introduction, senior most IOH member and having vast experience in this field of occupational safety health. He is going to present the global report prepared around enhancing social dialogue for improved occupational safety and health. Act together to build a positive safety and health culture. I hope.
Thank you, President sir. So this annual day for safety and health at work, that is 28th of April, it is now being celebrated globally, and even IOH branches, they are planning to organize certain programs before this particular program and after this program also. And as you rightly said, that this day focuses on enhancing social dialogue towards a culture of safety and health. And Indian Association of Occupational Health, we are committed to enable occupational professionals to make India's workplaces safe, healthy, and green, free from the ill effects of hazards by evolving the effective solutions. And now, before we move forward, may I request our Vice President, Dr. Sanjay Auditor, he is also Scientific Committee Chairperson of Indian Association of Occupational Health, to give his kind words.
Thank you, Dr. Sandeep, and good evening, everybody. President Sir has told us the importance of the day. To background, actually, since 2003, the International Labour Organization, ILO, began to observe the World Day in order to stress the prevention of accidents and the disease at the workplace, capitalizing on the ILO's traditional strengths of tripartism and social dialogue. Also, 28th April is also the International Commemoration Day for Dead and Injured Workers, organized worldwide by trade union movement since 1996. Its purpose is to honor the member of victims of the occupational accident and diseases of the organizing worldwide mobilization and awareness campaigns. Every day, 6,300 people die as a result of occupational accident or work-related diseases. more than 2.3 million deaths per year, 317 million accidents occur at the job annually, and many of these resulting in extended absences from the work. The human cost of this daily adversity is vast, and the economic burden of poor occupational safety and health practices is estimated at 4% of the global gross domestic product each year. So the theme this year given is let us act together to build a positive health and safety culture. So let us celebrate this day all of us creating awareness in all the stakeholders. Thank you.
Thank you, Vice President, sir. So, Indian Association of Occupational Health, we are committed to enable occupational health professionals to make India's workplaces healthy, safe, and green. And we at Indian Association of Occupational Health, we have more than 3,000 occupational physicians, industrial hygienists, safety professionals, social workers, and counselors to realize our future vision. In addition to strengthening our current activities, we plan to expand our scope to address the broad objectives which have been outlined by our seniors. And this particular effort is a milestone in this endeavor. And as you all rightly said, that this particular dialogue, enhancing social dialogue towards a culture of safety and health, it is towards building and maintaining a preventive and safety and healthy culture in our respective organizations and across India. And this culture in which the right to a safe and healthy working environment is respected at all levels, where governments, employers, and workers, they actively participate in securing a safe and healthy working environment through a system of defined rights, responsibilities, and duties, where principles of prevention is accorded the highest priority. So we thought that we should have a dialogue on this particular day, and for this we had requested Dr. Rajiv Kumar Jain sir to give a broad perspective of this day and how we can work towards achieving this social dialogue towards a culture of safety and health in our respective organizations and across India. And from Indian Association of Occupational Health, I invite Dr. Rajiv Kumar Jain, who is also Vice President of AUSD, and he is MD Pediatrics and DNB Health Administration, including Hospital Administration and Certificate and Diploma in Chinese Language, University of Delhi. He has been a great resource person for Indian Association of Occupational Health, and we all industrial and occupational health physicians. For last 2 years, we have seen how he has contributed and how he has made us aware of the evolving COVID pandemic situation so that we can take care of our employees and our workforce across our organizations. He is a senior health consultant, Indian Railways, Delhi, with more than 40 years of experience in health and hospital administration, Fellow Award of Indian Public Health Association, and Fellow Award of Indian Association of Occupational Health. He has also been awarded Fellowship of Association of Environment and Occupational Delhi, and he has published and presented more than 145 scientific papers and national and international conferences, fellowships, scholarships by WHO, NIH, USA, Canadian Society for International Health. And he is member of the Managing Committee, Scientific Committee on Epidemiology and Occupational Health of International Commission on Occupational Health, ICO, and core group member of Guidelines for Medical Preparedness and Mass Casualty Management of the National Disaster Management Authority. So Dr. Rajiv Kumar Jain sir is here to guide us how to take this particular mission forward. And we are joined by many of our seniors, our past presidents, our other colleagues, senior colleagues, and ICO board members from India. And with this, I request Dr. Rajiv Kumar Jain sir, you please start your deliberations for this particular important auspicious day. so that from Indian Association of Occupational Health, we can continue this dialogue and create safe and healthy workplaces across India.
Thank you, Dr. Sandeep Sharma, for the nice words that you have spoken about me. I do not know how much I deserve, but all the same, I must at the outset thank Indian Association of Occupational Health for organizing this event just after the global webinar finished from International Labour Organization. 1.5 hours webinar where the entire globe collected and voiced their collective strength towards the theme of building a positive safety and health culture by acting together, by showing that they can act together, developing and developed, rich and poor, industrialized and not so industrialized together for 1.5 hours. They deliberated and voiced their collective wisdom and strength to strengthen this positive safety and health culture. So the foundation has been laid today on the World Day for Safety and Health at Work on 28 April 2022. And fortunately, we saw Dr. Yuka Takala also being there in the global webinar, which finished just before this webinar started at 6:30 p.m. So let's get going. So in the beginning, I would like to share our opening video from International Labour Organization on today's momentous occasion. This video is reflective of the seriousness.
Everyone has the right to return home from work safe and sound. Sadly, this is not the case for the nearly 3 million workers who die each year due to occupational accidents and diseases.
Nor for the hundreds of millions more who fall sick or are injured at work. ILO standards in occupational safety and health foster safe and healthy working environments to prevent such human tragedies.
The COVID-19 pandemic has put the need to safeguard workers at the center of the global agenda. Around the world, workers and employers' representatives have collaborated to develop workplace policies and strategies to protect people from the virus and other related risks.
They worked closely together to create and put into place mitigation plans, including screening processes, contact tracing, and other measures to reduce the spread of the virus in the workplace.
This year's World Day for Safety and Health at Work highlights the importance of social dialogue in promoting a positive occupational safety and health culture.
Social dialogue refers to the active participation of representatives of workers, employers, governments, and other key actors in all phases of occupational safety and health decision-making.
Workplaces with higher worker engagement have reported 64% fewer safety incidents and 58% fewer hospitalizations.
This shows that open communication and cooperation between workers and employers is the most effective way of reconciling interests and implementing policies that save lives.
Let's act together to build a positive safety and health culture.
So, needless to say, after this overwhelming evidence shown in this video, that there is no alternative to acting together.
Everyone has the right to return home from work safe and sound. Sadly, this is not the case for the nearly
now. As we discuss this subject now in more detail in the IOH webinar, which is the opening webinar of IOH, and we believe that after this webinar, subsequent webinars will also be conducted to further discuss and take up all stakeholders on board. Could we have the next slide, please? The theme for this year is enhancing social dialogue because unless we do social dialogue, a culture of safety and health can never be developed. So on the right top, you see a diverse range of actors sitting in diverse ways and discussing. That's the depiction of the social dialogue. And this is how the social dialogue needs to be built up gradually but surely. Next slide, please. Building and maintaining a preventative safety and health culture. In 2006, the promotional framework for occupational safety and health convention number 187 said a culture in which the right to a safe and healthy working environment is respected at all levels, where governments, employees and workers actively participate in securing a safe and healthy working environment through a system of defined rights, responsibilities and duties, and where the principle of prevention is accorded the highest priority. Please remember, the emphasis is on active participation, and also rights go with responsibilities and duties, and highest priority is accorded to the principle of prevention. Could we have the next slide, please? At the national level, the government as a whole commits to building and maintaining a preventative safety and health culture. Ensuring occupational safety and health is considered a priority in the national agenda. And this is the role which Indian Association of Occupational Health has to present and put forward to the government of India. Adequate means and resources are allocated to increase general awareness of occupational safety and health, knowledge of hazards and risks, and understanding of their prevention and control. Through social dialogue, that is, the tripartite constituents actively participate in all phases of the occupational safety and health decision-making processes. The social dialogue contributes towards improving the quality of occupational safety and health policies and strategies. It also contributes toward building ownership and commitment, and also contributes toward facilitating their rapid and more effective implementation. So from policies and strategies to ownership and commitment and to effective implementation. That's the strength of social dialogue. At the workplace level, which is all with the responsibility of all stakeholders, especially the organization and the occupational health physicians and the safety engineers. They have to ensure compliance with occupational safety and health regulations. They have to also ensure integration of occupational safety and health management systems into the business's general management structure, and also culture change to achieve a positive OSH culture. OSH is considered as a core value of enterprise, integrated into every aspect of the enterprise dealings. Open communication and dialogue built on trust and mutual respect. Positive OSH leadership by employers and top management. Training and information for all workers to ensure they can actively participate in actions to improve OSH. Now, the importance of this social dialogue during the COVID-19 crisis. The key role of the social dialogue during the COVID-19 crisis at the national level and at the workplace level. At the national level, governments who prioritize the active participation of employers and workers' organizations in OSH governance have been able to collectively develop and implement emergency laws, policies, and interventions. And at the workplace level, workers' participation and engagement through joint OSH committees and workers' OSH representatives have been key in promoting compliance and designing and applying suitable and effective measures to eliminate hazards or minimize risks that are adapted to the workplace and workers' needs. This is the biggest learning of the COVID-19 crisis. It has once again underscored the importance of a social dialogue. Why is it important to voice concerns around safety and health at work? And also now that is the time to understand what is social dialogue. The social dialogue refers to all types of negotiation and consultation, or simply the exchange of information between or among representatives of governments, employers, and workers on issues of common interest relating to economic and social policy. The social dialogue may be informal or institutionalized and often includes both. The social dialogue may take place at different levels: international, national, regional, local, or workplace. And the social dialogue may involve the social partners in different economic sectors, within a single sector or in a single company or group of companies. So look at the diversity of the social dialogue. The various forms of social dialogue could be tripartite, tripartite plus, and bipartite. The tripartite process with the government, Ministry of Labor, and or other ministries concerned as an official party to the dialogue. The second one, that is a tripartite plus process when dealing with issues beyond the world of work, with actors representing specific concerns and interests of the civil society. The bipartite, that is the third form of social dialogue, but bipartite relations between labor and management or employers and workers organizations, has two parts: collective bargaining and workplace cooperation. In collective bargaining, which consists of all negotiations which take place between an employer, a group of employers, or one or more employers organizations on the one hand, and one or more workers organizations on the other. For what purpose? Three purposes. A, determining working conditions and terms of employment, and or B, regulating relations between employers and workers, and or C, regulating relations between employers or their organizations and a workers organization or workers organizations. And the second kind of bipartite relations is workplace cooperation, which ranges from information sharing to consultation or joint decision making. Social dialogue is at the heart of the International Labour Organization. The tripartite structure of the International Labour Organization allows employers, workers, and governments to take part in the decision-making on international labor matters to promote social justice and decent work for all. The social dialogue is embedded in the ILO Constitution and in almost all international labor standards as a key method to achieve sustainable decisions and peaceful workplace relations. Let's look at the specific conventions which promote social dialogue. The first is the Tripartite Consultation International Labour Standards Convention 1976, number 144. Second one is Freedom of Association and Protection of the Right to Organize Convention 1948, that is number 87, and the Right to Organize in Collective Bargaining Convention 1949, number 98. These two are fundamental conventions. And the third one is a Collective Bargaining Convention of 1981, number 154. So remember, number 144, number 87, number 98, and number 154. The social dialogue is echoed in one of the categories of fundamental principles and rights at work, namely freedom of association and the effective recognition of the right to collective bargaining. The International Labour Organization Declaration on Social Justice for a Fair Globalization of 2008 and the International Labour Organization Centenary Declaration for the Future of Work in 2019 have reiterated the relevance of social dialogue to building up social cohesion and a productive economy. Could we have the next slide, please? Participation and consultation at the core of ILO standards on occupational safety and health. Occupational Safety and Health Convention 1981, number 155, calls for a national policy on occupational safety and health, formulated, implemented, and reviewed in consultation with most representative organizations of employers and workers, which promotes communication and cooperation at different levels, from workplaces to national and indicates the respective OSH functions and responsibilities of the public authorities, employers, workers, and others, taking into account the complementary character of such responsibilities. And it also calls for, at the workplace level, establishment of the arrangements needed to enable workers and their representatives to cooperate with employers in the field of occupational safety and health. It also has arrangements for providing adequate information and training. And third, it also allows workers or the representative to inquire into and be consulted on all aspects of OSH associated with their work. So it's very much part of International Labour Organization at the national and workplace levels. Here again, Occupational Health Services Convention 1985, number 161, calls for consultation, cooperation, and participation. Consultation with the most representative organization of employers and workers to formulate, implement, and periodically review a coherent national policy on occupational health services. And cooperation, participation of the employer, the workers, and the representatives in the implementation of the organizational and other measures relating to occupational health services on an equitable basis. The promotional framework for Occupational Safety and Health Convention of 2006, number 187, promotes a national preventative safety and health culture built on social dialogue. It also calls for tripartite consultations on the formulation, implementation, and periodic review of a coherent national policy on OSH. It also lays down the establishment, maintenance, progressive development, and periodic review of a national system for OSH. The formulation, implementation, monitoring, evaluation, and periodical review of a national program on OSH provides that the national OSH system shall include arrangements to promote at the level of the undertaking cooperation between management, workers, and their representatives as an essential element of workplace-related prevention measures. Now, at the national level, the role of the social partners in building a preventative safety and health culture. We shall discuss this aspect because this is a fundamental component of the social dialogue. Participation of the social partners in the OSH governance is essential. Creating a sound culture of prevention on OSH requires the participation of employers and workers' organizations in the governance of safety and health at work. The tripartite partners may have different interests and perspectives. The tripartite consultation and discussion may contribute towards an improvement in communication and lead to a better understanding of any concerns and constraints they might have, paving the way for joint and agreed actions and for development of a collaborative culture for addressing OSH challenges. Strong coordination amongst all the stakeholders is required to define common goals, priorities, objectives, and targets for strengthening the OSH national system, bringing about more efficient use of the available resources. Adopting sound OSH policies through social dialogue. The Occupational Safety and Health Convention 1981, that is number 155, and the Promotional Framework for Occupational Safety and Health Convention 2006, number 187, call for the adoption of coherent national OSH policy. Such a policy should be built through tripartite consultation and discussion. This confers legitimacy and favors its implementation. It includes at least government commitment to the prevention of occupational accidents and diseases, the main principles guiding national action on OSH, spheres of action on OSH, functions and responsibilities of the main stakeholders, that is relevant public authorities, employers and workers and their organizations, recognizing the complementary character of their responsibilities. Now, we come to the implementing effective OSH regulatory framework. A comprehensive and functional regulatory framework should cover all workers and all branches of economic activity. It should also address all OSH-related risks to which workers may be exposed. An effective OSH regulatory framework usually includes 4 aspects. That is, 1, a single overarching OSH Act defining the basic OSH rights. Second, laws and regulations, completing the OSH Act and covering specific sectors or hazards. Third, codes of practice and technical standards, complementing the law by providing more specific guidance to employers and workers on how to comply with the law. And fourth, the last one, collective bargaining agreements resulting from negotiations between employers and workers and their respective organizations. When developing OSH legislation, the integration of social dialogue at various levels favors the sustainability and enforcement of such laws, even when they are complex. The COVID-19 pandemic has correlated with an increase in bipartite and tripartite agreements with a view to mitigating the risk of contamination in the workplace. 83% of trade unions surveyed have adopted social dialogue as a response to the pandemic. 83% of trade unions surveyed have engaged in tripartite consultation. That is the evidence which has come out from COVID-19 and recovery, the role of trade unions in building forward better. This is 2021. Now, 59% of 133 countries surveyed have adopted tripartite dialogue in response to the COVID-19 crisis, with one of the priority areas for negotiation being occupational safety and health measures. This has come out as evidence from 2021 report, a global trend analysis on the role of trade unions in times of COVID-19, a summary of key findings. Trade unions in a global survey noted that COVID-19 increased the impact of OSH on their collective bargaining agendas. Both tripartite and bipartite agreements focused on various fields of action, that is, requirements for risk assessment, telework arrangements, provisions on systematic testing, and vaccination. During COVID-19 crisis, social dialogue has been essential for ensuring the implementation of measures put in place. In Austria, for example, social partners negotiated an agreement on systematic testing in the workplace for particular sectors at increased risk of viral transmission. In South Africa, tripartite discussions resulted in requirements for employers to undertake a risk assessment of the workplace before workers return to work and to create a plan for their return to work. National consultation has sometimes been followed by further dialogue and agreements at the regional or sectoral level to adapt to the specific context. For example, in Singapore, tripartite partners agreed upon safe management measures, which is mandatory for all employers to operate during COVID-19, and additional sector-specific requirements covering an extensive number of sectors from aviation to arts and culture and land transportation. Throughout the COVID-19 pandemic, the scope of dialogue was also expanded to include collaboration between the labor sector and the public health sector. In such public health crises, workplaces have a role to play in the overall mitigation of community spread, as they are settings where people often gather in close proximity to each other. For example, in Philippines, the tripartite national level dialogue on public health, that is labor collaboration in the prevention of COVID-19 in the workplace, provided an opportunity for the authorities to explain the benefits of emergency volunteer workers, as well as to inform workers likely to be infected by COVID-19 of available social protection measures. It resulted in the establishment of an interdisciplinary knowledge management system, which would harness available epidemiological, labor inspection, social protection, and international best practices data, with a view to continuously monitoring risks at the workplace and further guiding OSH policies and programs. Now we talk of promoting compliance. The social partners are key actors in the initiatives, schemes, and activities to promote, monitor, and enforce compliance with relevant OSH laws and regulations at the workplace through collaboration and support to labor inspection activities and other mechanisms to promote compliance, that is, advisory services, codes of conduct, contractual requirements, awareness raising, and incentives with stronger impact when developed jointly by employers and workers' organizations. A functioning tripartite body to ensure consultation and collaboration. Convention number 187 calls for the establishment of a national tripartite advisory body or bodies addressing OSH issues. The tripartite OSH bodies or councils or committees have been set up in many countries. They provide a forum for the representative of government, that is Ministry of Labor and other relevant ministries and institutions, employers and workers to regularly discuss about OSH, ensuring consultation on relevant issues and a periodic review of OSH policies and programs. the tripartite composition can be expanded to involve representatives of additional institutions. For example, in Brazil, the Permanent Joint Tripartite Commission, the Comissão Tripartite Paritária Permanente, CTPP, is made up of 18 members, representing in equal number the federal executive branch, employers, and workers. In addition, it is possible to invite a maximum of 6 specialists and or representatives of other bodies or international organizations to participate in meetings of the CTPP or other thematic commission without the right to vote. The functions of these bodies vary considerably from country to country, ranging from a consultative role to a decision-making role in the definition of national policies, priorities, and action plans, as well as in drafting of laws and regulations. For example, in Oman, the task of the National OSH Committee include: first, drafting an OSH national plan; second, investigating serious work accident; third, coordinating between the Ministry of Manpower and other ministries, the private sector, and other concerned parties to implement OSH program; fourth, disseminating good practices on OSH; fifth, promoting research and studies on OSH; sixth, promoting employers and workers' participation in the field of OSH and the successful implementation of OSH program; seventh, exchanging experience with associations, committees, and other parties in the field of OSH; eighth, advising on OSH legislation; nine, organizing meetings to discuss OSH measure; 10, cooperating with Arab and international organizations concerned with OSH. During the COVID-19 pandemic, many tripartite OSH bodies took part in the decision-making process at the national level. They have also been involved in definition of lockdown and restriction measures, return to work strategies, and other instructions or guidance to mitigate the impact of COVID-19. For example, in Congo, the National Consultative Labor Committee reviewed the draft legislation on telework. In Honduras, the Tripartite National Commission for Workers' Health was reactivated for updating OSH legislation and its national OSH program to include issues of emerging importance such as psychosocial risks and hazards related to COVID-19. In Paraguay, the Tripartite Labor Consultative Council validated some framework OSH protocols for essential sectors of the economy, which were developed in accordance with ILO guidelines for a safe and healthy return to work in times of COVID-19. There are other relevant activities of social partners in the field of OSH, like guidance and technical assistance to positively influence employers and workers' attitudes towards OSH compliance and creating a more preventative culture. In addition to providing information, training, and advice, employers and workers' organizations can also encourage the exchange of experiences and bolster collaboration. Second, awareness-raising campaigns to disseminate essential information and make employers, workers, and communities familiar with their rights and responsibilities in the field of OSH. Such campaigns can have a stronger impact when jointly designed and implemented by employers and workers' organizations. OSH research is an important area, participating in the governance of OSH knowledge bodies to ensure that the outcomes of OSH knowledge development efforts meet the priority workplace needs. And fourth, collection of data and information on OSH to adopt informed evidence-based policies, strategies, and standards. During the COVID-19 pandemic, social partners have been very active in producing guidance materials and other resources and organizing awareness-raising campaigns on several OSH issues, such as preventative measures for mitigating the spread of COVID-19, including by promoting vaccination and effective teleworking practices, and for managing psychosocial risks, including violence and harassment. In Belgium, cooperation between social partners resulted in the generic guide for combating the spread of COVID-19 at work, which is adaptable to different sectors and emphasizes the importance of social dialogue at the enterprise level. In South Africa, the Southern African Clothing and Textile Workers Union, SACTWU, led a successful vaccination campaign for workers through primary healthcare clinics. The campaign raised workers' awareness of the benefits of vaccination, helping sway many of those who had been initially hesitant. As a result, garment sector workers had doubled the vaccination rates of the national average. In Nicaragua, the Senior Council of Private Enterprises, COSEP, launched the campaign, "If COVID-19 does not discriminate, neither should you," with webinars and platforms for exchanging best practices among stakeholders. In United Kingdom, the Prince's Responsible Business Network created the Mental Health for Employers Toolkit to help employers assess their workforce's mental well-being and champion positive health. Social partners have also carried out surveys and studies to ascertain employers' and workers' opinions on critical aspects of the organization and implementation of preventative measures in enterprises. The International Organization of Employers, IOE, and the ILO produced a joint global survey of employer and business membership organization, EMBOs, to examine the impacts and responses to COVID-19 in workplaces. The survey identified the need of EMBOs to receive more guidance on teleworking policies, as well as ways to implement government requirements for mitigating the risk of the virus in the workplace. The International Trade Union Confederation, ITUC, surveyed 148 trade unions in 107 countries to collect data on workplace safety measures and workers' experiences during the pandemic. This survey identified gaps in access to safe workplaces and global concerns about the provision of personal protective equipment. Now we come at the workplace level. Employer and worker cooperation for effective OSH management at the workplace level. The roles of employers and workers in basic OSH rights and responsibilities. On the left are employers' responsibilities, on the right are workers' rights and duties. Amongst the employers' responsibilities are ensure that so far as is reasonably practicable, workplaces, machinery, equipment, and processes under their control are safe and without risk to health. Ensure that so far as is reasonably practicable, chemical, physical, and biological substances and agents under their control are without risk to health when the appropriate protective measures are taken. Provide, where necessary, adequate PPE at no cost to workers. Provide, where necessary, measures to deal with emergencies and accidents. Also, ensure that workers and their representatives are consulted, informed, and trained on OSH. Now we come to workers' rights and duties. Right to remove themselves from a work situation which they have reasonable justification to believe presents an imminent and serious danger to their life or health without undue consequences. Right to receive adequate information and training on OSH. Right to inquire into and to be consulted on all aspects of OSH associated with their work. And duty to cooperate with the employer in the field of OSH. For example, comply with OSH instructions and procedures, use PPE correctly, report to supervisor hazardous situation, etc. Ensuring worker and employer cooperation on OSH. That is, participative arrangements in the workplace are associated with improved OSH management practices, better OSH performance, reduced accidents and injury rates, and higher productivity. In the meta-analysis by Harter et al., the relationship between engagement at work and organizational outcomes of 2020, 64% fewer safety incidents were found. 58% fewer hospitalizations were found in workplaces that are promoting workers' engagement while implementing a positive OSH culture. Similarly, in Lloyd's Register Foundation World Risk Poll of 2019, over 300 million workers around the world feel that they cannot report OSH issues to their employers without fear of punishment. Worker OSH representatives, they have key functions which are listed out in this slide. Representing workers in all matters relating to OSH, monitoring the measures taken by employers to meet their OSH responsibilities, investigating OSH issues raised by workers, inquiring into any potential risk to worker safety and health that arises from their work, making representations to management on matters that affect the safety and health of workers, collaborating with and assisting the employer to address OSH risks, promoting and encouraging cooperation of workers in the field of OSH, participating and representing workers in decision-making processes regarding OSH, investigating occupational accidents and diseases, as well as near misses. Evidence shows a positive relationship between engagement of workers' representatives on OSH in the workplace and better OSH performance. That's overwhelming evidence for that. Joint OSH committees have a very important role. Joint OSH committees are bipartite bodies composed of equal number of workers and employees representatives established in the workplace and assigned to various functions to ensure cooperation between the employers and workers so as to achieve and maintain safe and healthy working conditions and sound working environment. Functions, rights, and powers are usually similar to those of workers' OSH representative. often higher number of statutory and complex tasks than those of individual workers' representatives, as joint OSH committees have more human resources and capacity. The establishment of joint OSH committees is mandatory in many countries, although this is often contingent upon the size of the enterprise. In countries where national OSH legislation does not regulate joint OSH committees, collective agreements may assume this function. Like in Sri Lanka, an agreement between the Joint Apparel Association Forum, JAAF, and a group of trade unions established provisions for bipartite health committees in garment factories in order to address COVID-19 related OSH risks and improve worker safety and health. Promoting OSH management systems built on social dialogue. OSH management systems are a logical and useful tool for the continual improvement of OSH performance within an organization. They include a set of actions and processes that establish, monitor, and evaluate the organization's efforts to keep workers safe and healthy and comply with national laws. Key elements for their successful application are integrating the OSH management system within overall business management and ensuring both the commitment of management and the active participation of workers in their joint implementation. ILO guidelines on occupational safety and health management systems, ILO OSH 2001, is shown in this diagram on the right, where audit is at the center, policy, organizing, planning and implementation, evaluation, action for improvement are part of a continuous cycle. And auditing also is part of the continuous cycle. So continual improvement is ensured. Workers' participation is an essential element of all of the OSH management system and is required at all its stages. Employers should ensure that workers and their OSH representatives are consulted, informed, and trained on all aspects of OSH, including emergency arrangements associated with their work. Employers should make arrangements for workers and their OSH representatives to have time and resources to participate actively in the processes of organizing, planning and implementation, evaluation, and action for improvement of the OSH MS. The employer should ensure, as appropriate, the establishment and efficient functioning of a safety and health committee and the recognition of workers' OSH representatives in accordance with national laws and practice. Creating a positive OSH culture. OSH management systems are only effective when accompanied by a positive OSH culture in the workplace, where management and workers value the right to a safe and healthy working environment and actively participate towards this end. Hong Kong Special Administrative Region of China, the incidence of occupational injuries and diseases in the region from 1986 to 2013 decreased thanks to the implementation of various OSH actions. Technology and OSH management systems have made great strides in creating a safer world, but it was the introduction and enhancement of safety culture within the workplace that markedly reduced the number of accidents. The positive OSH culture, open communication and dialogue between workers and employers, where workers feel comfortable sharing their thoughts about incidents and concerns, and leadership and commitment to OSH by employers and senior management. The core values are 7 core values. That is social involvement, justice, trust, sustainability, participation, resilience and flexibility, development and growth. These 7 core values influence on OSH and business performance. On the right side, you see the stages of development. You see pathological, employers and workers do not care about violating safety rules. Reactive, safety becomes important only after an accident. Calculative, systems are in place to manage all hazards. Proactive, workers avoid problems in advance to improve the work environment. And generative, OSH is built into ways of working and thinking. That is dynamic OSH culture, which is the best. So you see the hierarchy involving workers in the risk assessment process. As part of OSH management, employees should regularly conduct a risk assessment, which should include identifying hazards, evaluating the associated risks, and taking sensible and proportionate measures to control such risks. A well-conducted workplace risk assessment contributes to the protection of workers' health and well-being, benefit businesses through a better organization of working practices, potentially increasing the productivity. Employers should ensure that workers and or their representatives are fully involved in the risk assessment process as they have useful information about how the work is done. And this will help make the risk assessment more thorough and effective. During the COVID-19 pandemic, the active participation of workers and their representatives in any decision-making process contributed to the adoption of sustainable and appropriate solutions to face new hazards and risks, and resulted in a stronger commitment to the decision taken. For example, in Ireland, the HSE produced guidance stressing how essential it was to consult with workers at every stage of implementing COVID-19 measures in the workplace. It also underlined the need to appoint a COVID-19 lead worker representative to assist in implementing and communicating COVID-19 measures. Often, the need to work from home posed considerable challenges to ensure safe and healthy working conditions, for which both employers and workers were not always prepared physically, mentally, or infrastructure-wise. Regular communication about concerns and challenges experienced is essential to ensure cooperation between employers and people who are working from home. A multinational aerospace company, namely Mercury Systems, has surveyed its workers regularly during COVID-19 induced teleworking to identify areas of concern for workers and receive feedback. A software company based in UK, that is Sage, created a live anonymous poll for workers to report observations regarding OSH plans adopted to deal with the COVID-19 pandemic. The ILO produced a number of tools to support employers and workers in managing OSH risks during the COVID-19 pandemic, including anticipate, prepare, and respond to crisis, invest now in resilient occupational safety and health systems in April 2021, prevention and mitigation of COVID-19 at work, action checklist of April 2020. In the face of a pandemic, ensuring safety and health at work, that is the World Day of Safety and Health at Work report, April 2020, a safe and healthy return to work during COVID-19 pandemic in May 2020, a safe return to work 10 action points in May 2020, managing work-related psychosocial risks during COVID-19 pandemic in June 2020, practical guide on teleworking with the COVID-19 pandemic and beyond in July 2020, COVID-19 and health facilities checklist of measures to be taken in health facilities in July 2020, hand hygiene at workplace and essential occupational safety and health prevention and control measure against COVID-19, briefing note in September 2020, and prevention and mitigation of COVID-19 at work for small and medium-sized enterprises, action checklist and follow-up in August 2020. The ILO has also developed a range of sectoral briefs that include sections focused on OSH issues. Now, we come to an important area, that is strengthening social dialogue to promote OSH during crises and beyond. The COVID-19 pandemic has exposed all people in the world to the risk of infection with the novel coronavirus, as well as to new and emerging risks related to this emergency and the newly adopted work practices. Country response to the COVID-19 pandemic have shown the importance of the participation of social partners in OSH governance, contributing to improve the quality of policies and strategies and facilitating their rapid and effective implementation by building ownership and commitment. Social partners have also been key in ensuring effective and coordinated communication and information to promote compliance and contribute to the subsequent adoption of adequate OSH measures at the workplace. Collaboration dialogue with other relevant stakeholders, such as partnerships with public health and emergency services actors on issues of common concern, have proven to be vital to reduce the spread of COVID-19, that is vaccination campaigns. We must carry this lesson with us to exit this crisis and help us face any future crises that might lie ahead, constantly striving to reduce OSH risks and prevent work-related accidents and diseases. In June 2021, International Labour Conference gave a global call to action for a human-centered recovery from COVID-19 crisis that is inclusive, sustainable, and resilient, that targets 4 key areas: inclusive economic growth and employment, protection of all workers, universal social protection, and social dialogue. Recognizes that safe and healthy working conditions are fundamental to decent work and asks countries to strengthen OSH measures by cooperating with public institutions, private enterprises, employers, workers, and their representatives on the provision of tailored practical guidance, support for risk management, introduction of appropriate control and emergency preparedness measures, measures to prevent new outbreaks or other occupational risks, and compliance with health measures and other COVID-19 based rules and regulations. It also recognized the role that social dialogue, both bipartite and tripartite, has played in the immediate response to the COVID-19 pandemic in many countries and sectors. And it's important to support delivery of the outcomes it sets out. Thank you for your attention and your generosity, because you have given your unhindered, unbroken attention during the discussion that we have shared with you. And I again thank the Indian Association of Occupational Health for giving me this opportunity to share this important area on the day of Occupational Safety and Health 2022. Thank you so much.
Thank you, Dr. Rajiv Kumar Jain, sir, for highlighting the importance of social dialogue towards a culture of safety and health. And we all from Indian Association of Occupational Health, we all know that we are an important organization who can take forward this social dialogue with the national and international and the local workplace managements also. And it is one of the key objectives and of our Indian Association of Occupational Health, which is very much there in our constitution also, to collaborate with international agencies, with national agencies acting in the field of occupational health for cross-border transfer of technology with reference to the best practices in occupational health to create safe and healthy workplaces. So this is a key issue which you have highlighted, sir. And now we are joined by senior members of IOH, our past presidents and ICO board members also they are there. So may I request the panelists, first Dr. Rajgopal sir, to give his words of wisdom, sir.
Thank you, Sandeep, and thank you, Rajiv, for this very comprehensive presentation, if I may say so. And I would have a few points for consideration for the IOH, especially since the President Vijay Rao is here and Sandeep, our Secretary General, is also here. What concerns me is that, Jain has done an excellent research and brought out all the aspects which are essential to strengthen worker health and safety through social dialogue. But if you look at the ILO conventions, and Jain would agree, India has not ratified many of these conventions. Yeah. So what is actually happening is that periodically, whether it's a WHO, whether it's the ILO, or whether it is any other international body, they give a clarion call, everybody rallies around them, and the next season it becomes a season of the past. The flavor goes away. For instance, you would understand that WHO gave a call of health for all by 2000. That's gone down the tube. Then you look at so many calls which have been given in the past, starting from ratification of various conventions, which are not happening. So I think what I would have loved from this session, and indeed, Sandeep, you can actually use this as a background to tell all the other people who are going to have these sort of sessions, please come out with some concrete recommendations which do not fall in the realm of rhetoric, but can be reality. And what do I mean by that? Can we have a white paper, a 2-page white paper, which we can give to the Ministry of Labor, saying that IOH met, we had a central discussion, we had a branches discussion, and this is what we propose to really enhance social dialogue at the grassroots level. I think that's the most important thing, to prepare a white paper. Now, how do you actually do that? Jain spoke about tripartite sort of a meetings with, which is very common in the ILO convention. I recollect a meeting, and maybe Shanbag after me can add to this. We met the Ministry of Labor, and we proposed a quadripartite sort of an agreement where IOH would also be a partner. And to our chagrin, we were told that trade unions had shot down this idea, because people are also interested in their own sort of a vested interest. So that is one issue which is keeping us back. So we need to reiterate this concept of quadripartite. Next, I come to the role of institutions in building social dialogue. And we have a number of institutions which I would like to allude on. One is the IOH, and I think over the last few years, we have been, if we can introspect and be fair to ourselves, we have been doing quite a lot of useful work. Yeah, there's no doubt about that. The entire BOHS, this booklet which we prepared and the training which we prepared is revolutionary. And that's one way of starting the social dialogue. But I am a little disappointed with the National Institute of Occupational Health. I don't know if anyone else is out here. They can do a lot of pioneering work, both in field and in applied research, which will enhance social dialogue. And the area of concern to me is the TLVs, which we have got for 29 chemicals or all the chemicals so far. 29, of course, are in the list of occupational diseases. These TLVs are not suitable for our country because we have a 6-day working week. We need to look at their exposure chamber studies, and they need to really strengthen it. Training in occupational medicine, I think barring the Public Health Foundation of India, any other course which is being offered across the country, and you might probably have to forgive me for using such harsh words, is slightly better than rubbish. Yeah, you can't teach somebody in 3 months, especially if your teachers who are teaching are not qualified. Mercifully, the new CLI chief is quite dynamic and is invited, and Shanbag will speak on that, how IAOH can contribute towards teaching people. If you don't have good occupational health specialists at the grassroots level, you cannot introduce social dialogue of any form. Yeah, that is the importance of teaching. The other one which I actually talk about was in terms of, Rajiv mentioned about China following the conventions, the Hong Kong region. But I must mention here a first-hand experience which I had in China. When I was the former chief of Unilever's global services, I used to visit China quite frequently. And once I visited Beijing and then Shanghai. In Shanghai, we had a lovely office. Those offices were just coming up. And I had and in front of it was a steel plant. And they said we peacefully coexist, a lot of pollution, of course. Afterwards, when I visited the same place within 1.5 years, there's a huge garden in place of the steel plant. And I asked my medical advisor, where is this plant gone? He said, no, they were causing pollution. We have uprooted the entire thing and put it in the countryside. So let's not, understand, let us understand that what China says and what China does is something totally different. We are a democratic country. And Sandeep always, keeps telling us that we need to take people together. I think it's extremely important that we need to take people together in these forms of social dialogue. So that's the most important thing. So many of us here, whether it's a PSU like Indian Oil or a Unilever or a Reliance, don't need ILO conventions to tell us what is good. We know what is good in terms of employee health, safety, and well-being. I think what we also need to do as IOH is to introduce this concept of ROI in all our units, across factories and all. That is one way of business believing that this is important. Employee health is the most important, and health is also good business. I think that's the one which we actually need to do. And those are the few thoughts which I had, Sandeep. But please do take up my suggestion of preparing a white paper seriously. Otherwise, we run the risk of being seen as a bunch of professionals who meet periodically and indulge in verbal diarrhea. I think we should get out of that. We are all well-meaning, but I think at the end of it, we must have a concrete action plan. Thank you for giving me this time. And Jain, once again, compliments for your extensive research. It was very useful. Thank you.
Thank you, Dr. Rajgopal sir. Definitely all these ILO conventions and WHO guidance and many other, even ICO also, these guidance documents these days, they are there to guide us, and we have to take out what is useful for us. As such, we should try to implement what is required, what is not required. Definitely it won't be of any use for us, but whatever is good for us, we should take it from these conventions and try to implement it. And definitely from Indian Association of Occupational Health, I assure you, sir, that we will come out with a white paper on this, what we should do and what we should not do. It is a 74-year-old organization, and yes, we have to have a commitment towards the organization, and that is what is more important. And all key stakeholders of IOH, they should participate in this in a united effort to bring out this white paper. It should not be like a document by a set of people, and because until unless, as you rightly said, I had been always telling that we have to involve everyone in our efforts, and we should take everyone on board across India for taking IOH forward. Now, may I request Dr. Shanbag sir is there. He can guide us on this particular social dialogue, which ILO says that we have to initiate in.
Thanks, Sandeep. At the outset, apologies, I was out and I just came in. I joined late. Of course, I will go through the presentation which Rajiv will send later on. But whatever gist of from the time I joined, whatever I understood on this social dialogue, I think it's a great initiative, and it should not be a one-time affair, as what Raj said just now. The problem which I see is very different. You see, today you look at associations. talk about IMA. If there is any health issue in the thing, IMA immediately responds to them and IMA is recognized. So if any governmental body wants some opinion, they fall back on IMA. So IMA is known at, it's a name which immediately falls with the government, and they check with the IMA to do that. So we need to first of all make our association visible to everybody, especially the governmental agencies. And for that, it has taken a long time. You know, Raj talked about a meeting with the Labor Ministry. That was maybe a decade ago. But you know, we have to first of all make ourselves visible, and that visibility will only come when we start writing on issues to the government. Once you start writing on issues to the government starts knowing that there is an association like this, and we should be able to look at it, and probably the expertise. We have come a long way. We do get consulted, and I'm sure people like Rajiv and Sandeep and all others in Delhi should be able to do that, and especially the office bearers of Indian Association of Occupational Health should make an effort to see that we comment on issues and probably write to the government, maybe at least to begin with once in a month on some issues. It may initially there may not be a response, but once you start writing, documents build up, probably we will be more visible in the governmental circles. So that we need to look at. Raj talked about the NIOH. NIOH falls under the Ministry of Health, and this problem is always there. We try to do that, and the Ministry of Health and the Ministry of Labor don't see eye to eye. So there's an issue with that. Probably over a period of time, we can bridge that gap. Third thing is we talked about the DG Fastly. We have been in talk with the DG Fastly. I personally have been quite, recently we also invited him during the Mumbai conference. And he was also chief guest of the national conference, which we held on a virtual basis. He has been quite open. And as a matter of fact, I met him yesterday also. And he is just waiting for the MOU to be cleared by the Ministry of Labor and Employment. And once he does that, he wants to have more interaction and coordination with the Indian Association of Occupational Health. And he even mentioned that he would like IOH to play a major role in the AFIH, which is going on, which probably will increase our role, and probably we could get more qualified people who understand occupational health, and once you do that only, and people start talking, each one of us should talk on occupational health wherever, in whatever fora we are. Then and then only the social dialogue will begin. So the whole issue is we need to sort of motivate all our people to see that they talk occupational health, and see how we can bring out and talk about IOH, so that we can how we raise the whole platform, so that the people we get recognized. Until we get recognized by all and sundry, and then only we will be able to look at it. You see, this country, democratic country today, I was a little disappointed when COVID pandemic came in. Everybody from other fields came in. Nobody from public health came in the limelight in the COVID pandemic. People have taken the opportunity, people have jumped, but I didn't see many people from public health becoming a part of the social dialogue. I do not know why it is. Probably some people from who understand this may be able to. So similarly, we need to look at the possibility of IOH commenting and sending papers or sending to the government of India. The first few years they may not respond to you also, but once they start seeing the papers from us, probably, this is not my wishful thinking, probably they will probably look at you as an organization which is an expert in occupational health, and probably come back to you for various advices and solutions. So my only suggestion is how do we motivate our membership to go ahead and talk about occupational health and be passionate about it. That is my submission to this forum. Thanks, Sandeep.
Yeah, thank you, sir. Yes, definitely more visibility is required. And if we have not achieved this visibility in last 74 years, then we should start thinking about it now. And may I request Dr. Shyam Pingle, sir, ICO board member from India, sir, to respond to this social dialogue forum. Dr. Shyam Pingle, sir. Yes, may I request Dr. Rajiv Kumar Jain, sir, to respond to the issue?
My connectivity is poor, Sandeep.
Yeah, Dr. Yeah.
Yeah, the connectivity on this side is poor. I am at Gandhinagar, so therefore I will not be able to speak much.
We are able to hear you. We can request Dr. Rajiv Kumar Jain to respond to. You can keep, yeah.
See, this process of social dialogue is a continuous process, and a momentous occasion and kind of revolution has already occurred through the parliamentary approval to the 4 labor codes, and that is a momentous occasion where the will of the people has prevailed over everything else. The previous archaic laws were replaced by 4 codes. Now, the rules also, fortunately, day before yesterday, the Minister for Labour and Employment Government of India also highlighted this in one of the important events that he attended. He said 19 states have already put forth the rules also to a rollout phase. And the commitment of this government showing that they are there for the 4 aspects of regulatory framework. That is the act, the rules, and the standards. As you know, DG Fastly was charged with making out the safety and occupational health standards. So this compliance with global regulations, the regulatory framework is very much there. Second, in the act itself, in the advisory board structure itself, whether in the center or the states, the role of the experts. So India has already adopted a quadripartite method. As the terminology globally is tripartite plus, as I mentioned there, and it's a globally accepted method of establishing and enhancing OSH policies, practices, and implementation and evaluation. That has already been rolled out by law of parliament, and the state legislature are in the process. So we are on right footing. We are in right direction. The government of India and the states are officially consulting the occupational health and safety professionals. If you read the act and the rules in all the states, in none of the states, the role of the occupational safety and occupational health professionals has been deleted. It remains there. So by law and the standards, for the first time, India never had occupational safety and standards, most of its regulatory framework. Now, for the first time, after 75 years of independence, we are going to have in place the act, the rules, and the standards together at one place. And the substantive process of dialogue with the trade union representatives, with the current Union Minister for Labour and Employment, has put forth very emphatically that this area requires consultation, and he has been actively engaging in consultation and ensuring that all the codes are accepted by employers, workers, experts, and of course the governments. And not only the central government, or not only the ruling party's government, but all the governments of all nature and color. I think that is the biggest achievement that India has made in occupational safety and health in the last 8 years. And the process is in the right direction, I feel.
Yeah. So, yes, social dialogue and with government and with the local workers, local management is definitely there. And this particular concept of enhancing social dialogue towards a culture of safety and health, this will further streamline and strengthen the conversation which is already going on, and it is very much is there in place. And our duty is to take the best which is good for us and try to imbibe it. And as Dr. Rajiv sir has rightly said that we have to take what is good for us, and we have to implement that in our organizations. And like for example, this concept of WHO healthy workplace model, this concept is very much there for last so many years, but some private organization, they have taken up this for initiating the awards, and suddenly this WHO healthy workplace model, it became so prominent that every third organization, they are running after it. So these sort of good practices and good guidance documents, they are very much there, and our duty is to take out the best from it and try to implement it before some third person comes and monetize out of it. So from Indian Association of Occupational Health, we will definitely try to imbibe good practices which are there, which are very much there in different conventions, and which will help us in further growing and bringing out our visibility. So this particular dialogue, it has given a boost today on this World Day of Safety and Health at Work 2022. And I thank all the participants, all the senior members, all the panelists to
Sudeep, can I come in for a moment?
Yes.
I have a little suggestion. That's why I've come in. Of course, our engagement with DigiConnect has gone on, and he had asked the president of the IOH to nominate some few people for the rules which Dr. Jain was talking, and our people did participate. That is one, just for the matter of information. But now, now we're talking about sustainability of this particular initiative of yours today. I request the president and the secretary to see whether we can, the Occupational Health Day is coming, and probably have a larger, consultation within our membership during the Occupational Health Day on this subject to take this forward. It is not very far away. 9th of July is there, and probably, if you can make a structured thing, it could be also discussed at various branch levels and come out with whatever documentation is there, whatever suggestions are there, which the central body could debate. And then probably it would help in the white paper which Dr. Rajgopal was mentioning. This is just a suggestion, and you probably should take it up with the president and the office bearers of the association.
Thank you, sir, for your suggestion. But I would like to inform you that we have proactively decided, and on this Sunday, 10:30, we are having meeting of all the branch president and branch secretaries for deliberating on this particular topic, and that what should be our guidance topic for the Occupational Health Day. And then on next Saturday, that is 8th, we have that has already been streamlined, and on 8th we will be having our central body meeting, in which we will invite all the past presidents and key stakeholders for giving us some guidance on how to take forward this particular initiative. So this is already proactively we have decided, sir. And thanks for reminding us. And thank you very much, sir. And yes, we all can together, we can do a lot, and we have to be together. And before we conclude, may I request our Vice President, Dr. Sanjay Rotito, sir, Chairman Scientific Committee, that we will come forward with more initiatives, more scientific initiatives. Dr. Rotito, sir, if you are there, you can just conclude by giving your remarks.
Yeah, first of all, I will my sincere thanks to Delhi branch actually giving this platform for our today's webinar and discussion. And whatever the concepts basically been told by our seniors, and we'll definitely try to incorporate, and we'll try to go with more number of scientific sessions in future. Thank you very much.
So with this, we come to a conclusion, and to conclude, may I thank everyone to spare their valuable time for this social dialogue initiative, and we will definitely take forward this particular initiative. We have to initiate a dialogue with government agencies, with the management, and even within our people also, our senior leaders also, and so that, because we have got a lot of targets, lot of future visions there with us, and we have to achieve them in a big way. So for this social dialogue with all the stakeholders, that is very important. And for this, I thank you all very much for sparing your valuable time. And thank you, Dr. Rajiv Kumar Jain sir, for giving this valuable insight on how to initiate this social dialogue. Thank you very much.